The next thing that we start looking at was PSA velocity, which in my opinion is a really good way to detect kind of hidden cases, okay? So PSA velocity is also a fancy way to say that you follow PSA over time. So the more PSAs you have, the better. And if you have PSAs from 10 years ago, perfect. And so you follow the PSA over time, and you kind of get a sense for what's normal for that person. Okay, so if you've always had a PSA of, 3, 3.5, 4, 3.8, because there's always going to be a little bit of variability. So don't think it's always going to be right on the money. The other thing that may happen is you could go to different labs, and different labs are going to have, different references. So that PSA can be a bit off, okay, from one measurement to the next. But there's no doubt that as you go through time, what happens to the prostate? As men get older, the prostate gets larger. So therefore, the PSA is going to gradually go up. Okay, what you never want to see is a PSA change of greater than 20% in 1 year. If that happens, then you have to go, what else could be going on? Could this be a lab error? So let's repeat it. Could this be an infection or some kind of inflammation? Or did that person, ride a bike 100? I had these patients who actually went for a 100-kilometer race the day before and had put a lot of, pressure on the prostate. So that's where, everybody understanding what can cause the PSA changes is very helpful, because we always want to be consistent. So PSA velocity, in my opinion, is great, and I'll tell you where it comes in really handy. Let's say you have somebody whose PSA has been 2, which is considered normal range. And all of a sudden, if they've been around there forever, they jump up to 3. A lot of people would say, wow, that's still normal, don't worry about it. But it's definitely not normal for that person, because going from 2 to 3 it's not normal. And that's why it's so important to find what's specific to each person, what the pattern is for each person. The same thing, the contrary to that is I've had patients who had PSAs of 8 and 9, but guess what? They've been like that for 10 years. So am I going to get crazy and biopsy them? Absolutely not. We have to use common sense above all.
So 2 questions about
Sure.
that. How often should you
do a PSA?
Do a PSA, and should you do, like when you're doing a cholesterol check, should you do a resting period before you have
Yeah, so that's a great question, and actually you picked the most controversial thing we have on PSA nowadays. It really depends on the age of the patient, it depends on the family history of the patient, and whether they have had an abnormal PSA before. As you can imagine, that is going to adjust the period in between. It can range from every 3 months to, once a year. It depends if the rectal exam was normal or not.